Now, we didn't have a positive indicator muscle change with biting down. And that's a screen for several things, but it's also a screen for neurological tooth. Now, if a patient doesn't show with that, that's a good sign, but if you have a history of the patient, if you know that there's some issue with the tooth, there may be a 51%er in there. So you can go directly into the mouth and you have the patient TL at the tooth gum line. And usually we start with the back. You do a couple teeth at a time, come around front, the upper around front, and then go to the other side. If there's a neurological tooth or some sort of tooth issue, a lot of times that will show it. So we'll go ahead and screen, and because we usually find one or two of those with Jade from time to time. So we're going to go ahead and dig a little deeper. I'm going to use the popliteus again. Seated popliteus works really good. Okay, so once again, take your right index finger. Make sure they're comfortable with sticking their own finger in their own mouth. Take your finger, and I want you to touch at the lower level of the tooth gum line without any biting or okay. Good. Now come forward. You can scan about 2 teeth at once. Come on around. Right there, and this is the one that we've been working on actually. Do you know which one that is? Go. Oh, you're on the top.
Yeah.
Okay, so you have the top. And then go to the next one that you scan. There it is. So what is that? Is that it's a front incisor. So let's go on around, do the front teeth, or the very front ones. Keep going on around. Keep going. You might find more than one. You often find more than one. Go all the way back. All the way back. All the way back. Good. Now go to the bottom. Tooth gum line. Keep on coming around. Good. Come on around. Keep going. There we go. Now get one of those teeth at a time. Good. Another one. Okay. See which one is that. So that would be her lower left. Okay, that would be the lower front incisor on the left. Keep on going. 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 That's it. Okay, good. Now I also will have you had your wisdom teeth out? Okay. Also, I will have the patient TL back where the wisdom teeth were, where the socket is. Go back and touch each wisdom tooth former site. Okay, then above. That was many years ago. Oh, there's one. Okay. Now do that again, but relax your jaw. There you go, and your shoulder. Yeah. See, we were finding something else there. Now do that again. Scrunch your jaw, like you're doing, and raise your right shoulder. Yeah. See, So that's creating something else in here. So beware, make sure they're not changing the parameters of the test. So we're going to cut there, and then we're going to go in and we're going to correct. Now, both of the teeth that we found on Jane were in the front. A lot of times they won't show with just the straight biting down screen. You need to go in and TL them. And so you have to know if there's a history there, or sometimes the patient will tell you, sometimes you have to ask them if they've had any damage, any root canals, anything like that. So we are going to now go back in to the teeth. Go ahead and open again for me. So the tooth that we found a positive TL on was this tooth here, and this here. Is right here. So we're going to start with this one, and I'm going to get on it, and I'm just going to gently move it in different directions and then test the strong indicator muscle here. So I'm going to give it a little challenge that way, give it a challenge that way. Sometimes I'll pull it down, sometimes I push it up. What you're doing is just trying to get a little bit of challenge in the, right there, that weakens. Okay, so breathe in and breathe out. So the breath in, so far breath in has been the key here. So breathe in, and I'm basically pulling it down, and with a little bit of lateral and posterior. And deep breath again. And let it go. And you'll get a feel after you work with these a while. You can feel a little bit of give. We're not moving the tooth in its socket so much as we're just reprogramming what the brain experiences when that periodontal ligament is challenged. That's pretty good. Oh, okay, we got it. So moving this up here. The same movement that I did for correction, I'm doing for challenge, and that's good. Let's go to the bottom one. You want to be efficient and fast with these two, because people they don't like having you poking around their mouth too long. This is the one right here, right? This would be the, now I'm going to pull out. I'm going to push in, pull out, breathe in, breathe out. There we go. There's an exhale. Okay, breathe in and breathe out. Okay, so this one has to be corrected on the exhale. Interesting. So breathe in, and then on the exhale, I'm going to make the correction. I'm pulling anterior. I've got a thumb and first finger right on that tooth, right at the gum line. Anterior on exhale. Anterior. And you'll remember another common exhale, always, cranial correction is parietal descent. We always correct on the exhale. Good. You okay? Good. And I'm going to give that a little challenge, and I'm going to give it a little bit other challenge. See if just go back and forth. Push in. In. Breathe in. Okay, so we're actually going to push it sort of down too. So breathe in and out. Good. Breathe in. I'm just supporting under the jaw once more. And again. Good. Good. Now challenge that again. And that's good. Okay. So we have corrected the TMJ, working on both masseters, a little bit on the internal pterygoid on the left and the external pterygoid on the right. We corrected a holographic subluxation in the jaw, and we did 2 tooth corrections, or what we call an AK, neurological tooth.